Are going to talk about Medi-Cal waivers. What are Medi-Cal waivers? And just know that there are different types of waivers in the state of California. The focus of this training is on a set of waivers that are called home and community-based services waivers. For example, you may be very familiar with the DD waiver. Well, the DDA waiver is a home and community-based services waiver in California. But in order to understand what waivers are, we need to kind of go back to when California decided to participate in the Medicaid program. When it did, or before it, when it decided it wanted to have federal financial participation, in other words, the federal government helping to pay for health services in California, the state sent to the Centers for Medicare and Medicaid, or CMS, a state plan. What was a state plan? It was a document that described the Medi-Cal program in California. California calls its Medicaid program Medi-Cal. And so so for example, it will have the different kinds of Medi-Cal programs in the state, eligibility, the types of services that are provided. There are mandatory services that the federal government requires that California provide, but there are a lot of optional services that California has that it doesn't have to have in its state plan. Assurances, rights, etc. So if you're ever interested in looking at the current state plan, you can go to this link. So Centers for Medicare and Medicaid approved a state plan. And so Medi-Cal was born in the state of California. And so in order to modify the existing Medi-Cal program or Medicaid program in other states, the state has two options. It has the option of submitting an amendment to the state plan or seek approval waiving some of the federal requirements. Because when California agreed to take Medi-Cal, have the federal government participate and take Medi-Cal, have Medi-Cal available in the state, it agreed to follow federal statutes and regulations and guidances. So two ways to do things. You either amend the state plan or you seek waiver of some provisions of some statutes or regulations that California has to follow. And a waiver allows the state to have different rules than the standard federal rules, like exceptions. In California, we have different kinds of waivers. So Section 1915C, when we talk about these sections, we're actually talking about the Social Security Act. So Section 1915C of the Social Security Act is where you will find the home and community-based waiver programs. That's the focus today. There's Section 1115 waivers. They're called research and demonstration waivers. We have those in California. Section 19B waiver programs too, have those in California. And if you want to see what waivers California has currently and some that it had before, you can go to the Department of Healthcare Services website and find that information. And you can actually go to the waiver, click on the waiver, and see the document, because a waiver is a document that's submitted to CMS for approval. So it could provide extra services to subpopulations of people. And when we get to the DD waiver, I'll show you the DD waiver so that you see what it is. And just know that the format of the DD waiver is the same format for all of the home and community-based waiver services. So let's dive deeper into the home and community-based waiver programs, services waiver programs. What are they? These waivers are so that people can get services and supports at home. so that they don't have to go into an institution. It's all about keeping people at home. And remember when I was talking about the federal rules, regulations, and statutes that the California has to follow? The home and community-based services waivers is asking the federal government to waive comparability, to waive statewide-ness. Why? Because the general federal rules require that if a state is going to offer Medicaid, it has to offer it throughout the state. It can't just decide, oh, we're going to have Medicaid in Southern California or Northern California or only in certain counties. No, it has to provide it statewide. The other thing that is required is called comparability. For those who qualify for full scope Medi-Cal, they have the opportunity to request services and supports in the state plan, any of them. It doesn't mean you will get them, because there are medical necessity standards, there's criteria sometimes for getting services and supports, but everyone gets the same opportunity for the same pool of services. And that's comparability. So when you were thinking about waivers, we're thinking of it's a waiver of these federal requirements that will give extra services to subpopulations of people. These people on waivers get more things than people who just have Medi-Cal in the state of California. So for example, the states can tailor their waiver programs. They can, here in California, we have a waiver for people with developmental disabilities. We have a waiver for AIDS. We have a waiver for people who want to be in the assisted living program. We have a waiver for people above the age of 65, and so forth. And so you're going to notice in all of these home and community-based services waivers that ineligibility criterion is, if you were not living at home, that you would meet the criteria for institutional care, the level of care that's described in that particular waiver. Why? Because these waivers are to keep people at home, and these are people who would, if they were not home, would qualify to go into an institution. With these waivers, the states can choose the maximum amount of people who can get on the waiver in a year's time. So some of these waivers have waiting lists. The DD waiver doesn't, because there's so many slots available in the DD waiver. So in order for CMS to approve the waivers, the state has to show that providing waiver services won't cost more than what the state would have to provide to pay in an institutional setting. That makes sense. The state has to ensure that the person's health and welfare are protected, that there are adequate and reasonable provider standards, and that services follow an individualized, person-centered plan of care. You'll notice in the waivers that that's a requirement. So what are the waivers now? What are the current waivers here in California? These are the home and community-based services waivers. We've got the Medi-Cal waiver program. It used to be called the AIDS waiver for anyone with HIV/AIDS. There's other criteria, but this is just a sort of a brief outline of the waivers. It's available statewide, so anyone who's on Medi-Cal can apply for this waiver if the person meets the criteria for the waiver, because each waiver has its own criteria for eligibility. The assisted living waiver is anyone who is disabled and 21 and older, and it's only available in 15 counties. So see, this is a waiver of statewide-ness, right? The home and community-based alternatives waiver is available to all people of all ages who are disabled all throughout the state. The home and community-based services waiver for the developmentally disabled, or we know it as the DD waiver, is available to people who are regional center clients all over the state. The multi-senior services program waiver is for people 65 and older, and it's only available in 41 counties. And the self-determination waiver is also for people who are regional center clients, and it's available statewide. So these are the current home and community-based services waivers. Now, you can only be on one waiver at a time. So if I'm on the DD waiver and I want to get into self-determination, I need to move from the DD waiver into the self-determination waiver. I can't be on both. Or if I'm on the DD waiver and I'm 65 years and older and I would qualify for the MSSP program, I can do that even though I'm on the DD waiver, but I have to give up the DD waiver to get on the MSSP. There are regional center clients who are not on the DD waiver, they are on the alternatives waiver. The alternatives waiver has something called waiver personal care services, where you get a budget, a dollar amount for services in a year, and those services are usually provided by, like if you're doing nursing services at home, usually provided by an LVN, sometimes an RN, but under waiver personal care services, you can have someone, if it's okay with the doctor and there's other criteria met, the services could be performed by someone who's not an LVN or an RN. So therefore, you're paying that person less, and therefore you have more hours, right? So that the DD waiver doesn't have that. So maybe that's a reason why some regional center consumers opt for the alternatives waiver rather than the DD waiver. Although for most people, there will be a wait list for the alternatives waiver. So that's important to know too. Let's talk about the DD waiver for a moment. No wait list. It's administered by the Department of Developmental Services through regional centers. So if you want to apply for the DD waiver, you have to talk to your service coordinator and apply through the regional center. You're not required to be on the waiver in order to receive regional center services. It behooves the regional center to get people on the waiver because if there's a service or support that needs to be provided in the IPP, and that's something that the waiver pays for, then the waiver will pay for that. Medi-Cal, the waiver is a service, a Medi-Cal service. So Medi-Cal is paying for that service rather than the regional center paying it out of its budget, so to speak. So, but in any event, even if you're not on the waiver and you've exhausted generic resources, or there are no generic resources, the regional center might have to provide that service or support. Remember I said,
anyone brushing his teeth?
Can you please mute yourself? And thank you. So remember I said that every waiver has its own eligibility criteria. Well, this is the eligibility criteria for the DD waiver. You have to be an active regional center consumer, meaning you're getting a service from the regional center. And I'm sure you wouldn't be surprised to know that there are people who are not getting any services through the regional center. Have full scope Medi-Cal, qualify. So the waiver itself tells you what levels of care will qualify the person for the DD waiver. And we're going to look at the waiver and I'm going to show you. But you have to qualify. If you were not living in your home, you would qualify to enter an intermediate care facility. And there are 3 levels of care, ICF care, that are available through this waiver, and that you're not currently enrolled in another HCBS waiver. We know that because you can only be on one HCBS waiver at a time, and that you choose to receive the services through the waiver and reside in the community, because that's what the waivers, these home and community-based services waivers, are to keep you at home, to avoid institutionalization. And now I want to talk about institutional deeming. There is no waiver called the institutional deeming waiver. It does not exist. As you saw the list, I showed you the waivers in California. There is no such thing as an institutional deeming waiver. What some of these waivers have is called institutional deeming. And what does it mean? We have to step back and understand what the general Medi-Cal eligibility rules are. So if a child is applying for Medi-Cal, the income of the parent with whom the child lives will be deemed to the child. Medi-Cal will consider that income to be the child's, and it's possible, and that's called deeming, and it's possible that that income, although it's the parent's income, may cause the child to not be eligible for Medi-Cal. But there's an exception. If you are on one of these waivers, like the DD waiver, the alternatives waiver, self-determination waiver, the MSSP waiver, if you're on one of these waivers that have the institutional deeming concept, it's there for eligibility, then if you qualify for the waiver, for example, here the DD waiver, when it's Medi-Cal's turn to determine eligibility, Medi-Cal is going to look at the child and pretend that the child is living in an institution. Pretend that the child is living in an institution, and therefore they don't apply the deeming concept. Because remember, deeming applies that the income of the parent with whom the child lives, And so institutional deeming is this pretend concept that the eligibility worker has to use and say, okay, we're not going to deem the parent's income. By the way, resources for a lot of these programs, really, the programs we work for don't matter anymore starting this year. Medi-Cal doesn't have resource rules. There are many Medi-Cal programs for the ones that we work with where there were resource limitations. We don't have those anymore. So it's really income. And so that is institutional deeming. Deeming is also applied for a spouse. So if I apply for Medi-Cal under the general Medi-Cal rules, my husband's income will be counted as if it were mine. Even if he doesn't give me a penny, it doesn't matter. It's going to count as if it were mine. Now, don't forget that I can have my own income. That will be counted. And for children can have their own income too, like child support, or they just have income because maybe they got an inheritance and that inheritance produces income. Whatever the case may be, there are children who receive income. That income will be looked at. So that is the institutional deeming concept. So sometimes kids, especially kids or spouses, don't qualify for Medi-Cal because of the deeming rules, but then they apply for one of these waivers, and Medi-Cal applies the institutional deeming rules. And therefore, the spouse's income is not counted, the parent's income is not counted. And so the process is with the DD waiver or self-determination, you start with the service coordinator. You can't go, there's nowhere else to apply for this waiver. You have to remember the eligibility criteria. So it's all for both the DD waiver and the self-determination waiver, it's through the regional center.
So, can I ask a question?
Sure.
So, my son, he had just done.
And we were talking about the DD waiver. So when you're on the DD waiver, the regional center can't use their purchase of service guidelines to limit the services that are available to the waiver, because the services that are in the waiver are Medi-Cal services. Under the waiver, you get an extra vehicle exemption. You get to have, well, it really doesn't matter anymore because resources don't matter for Medi-Cal anymore. So you can have all the vehicles you want. It's really, Medi-Cal nowadays is focused on income. That's what's going to make you eligible or not. And for people who lose their eligibility for DD waiver, Medi-Cal has to evaluate you for any of its other programs in the state of California before they terminate you. And for kids who lose their Medi-Cal, they don't get terminated right away. And when I talk about kids, I mean people under the age of 18. They could continue with their Medi-Cal in some instances for up to 12 months, and that's called continuing eligibility for children. And what are some of those services that are available through the DD waiver? This is just a list of services. I'm actually going to take you to the waiver and show you where you could find all of the services that are available through the waiver. Let me talk about what the difference is between someone who's on Medi-Cal only or someone who has Medi-Cal and is on a waiver, like the DD waiver, for example, because the DD waiver provides nursing care at home. So does the alternatives waiver, the other home and community-based services waiver. So if I'm on Medi-Cal and I'm not on the waiver and my needs are such that I need to have nursing care at home, maybe LVN nursing care at home. My only options under Medi-Cal are to try to do the best I can at home, but it may not be enough. Or I could go to a nursing home because Medi-Cal will pay for me to live in a nursing home. But I really want to stay at home. And so if I get on the DD waiver, for example, the DD waiver provides nursing care at home. So that's the difference. If I'm on Medi-Cal only, I don't get that nurse in the home. But if I'm on Medi-Cal and I'm on the waiver, a waiver service is nursing, skilled nursing, and I get that nurse at home. So extra services, extra Medi-Cal services for subpopulations of people. This is what the waiver is. And our rights under the Lanterman Act manual talks more about the DD waiver. So I put the link there for you. With every service in the healthcare world, there are medical necessity standards. So when requesting services under the DD waiver, you've got to meet its medical necessity standard. And that's whatever's so long as the service or support is reasonable and necessary to treat the disability or developmental condition, the service has to be specific, effective, and skilled. Now, once you're on the waiver, your eligibility for the waiver is reviewed at least annually. And that's done by someone who's called a qualified intellectual disabilities professional. They're in the regional center, and that's their job. Their job is to help you get on the waiver and do these yearly evaluations, because it wants to make sure that you still qualify for the waiver, because the waiver has criteria that needs to be met. Is your situation such that, if you were not living at home, you would still be eligible to enter the ICE intermediate care facility at whatever levels of care the waiver requires? So let's go ahead. I'm going to stop sharing because we're going to actually go to the waiver. Remember, I said the waiver is a document that was submitted to CMS for approval. And if you ever want to know information about the waiver, this is where you're going to go. So we're at the Department of Healthcare Services website, and we have, if we scroll down, we have current waiver. Let's see, this is the approved HCBS DD waiver. So let's go to the let's go to the letter, yeah. That may be just the letter, but let's look it up. Okay, this letter is from CMS saying, okay, we're approving your request to renew the waiver for people with developmental disabilities, because these waivers are time specific. This waiver happens to be every 5 years, the state has to renew the waiver. And you've requested a waiver of the Social Security Act to waive comparability of services. It's been approved for 5 years. The waiver will offer the following supports for waiver participants. So these are the changes to this new waiver, and it gives the list. So if we scroll down, and these are just some of the changes in the current waiver. And we scroll down some more, and these are the, anyway, complicated, but let's just scroll down to the waiver itself. So this is the waiver. Thinking that this is, hold on, can you scroll down a little more? I want to see effective date, because this is effective 5 years. This is not the current one. The current one is on the DDS website. So yeah, we're gonna go to the DDS website. You know, Lonnie, I think I can. When you sent it to me, I didn't really look at it because I thought it was the one we had used this last time. So let me show you guys how to get to that. I'll do it, Lonnie, that's fine. Let me get to it. Okay, let me show you how. Oh, you got it? Did you get it? Yeah, okay. So, okay, thank you. So this is if we go to the DDS website, by the way, you could go to the Department of Healthcare Services website under waivers and you'll find it. The website we were at is an older version on Google, I think. So this is the Home and Community DDS website. There's a primer on the HCBS waivers. You'll see self-determination here because self-determination is also a waiver. And then we scroll down and we go to the approved current waiver. And this is the letter that talks about we've approved it and these are the changes to the waiver, et cetera, et cetera. And then we scroll down. Can you make it a little bigger if possible? Just so, yeah. There we go. So this is, you see up on the right-hand side top, it says page 1 of 401 pages. This waiver is 401 pages. And in the beginning, it talks about the purpose of the waiver. You see 1915C, this is a home. When you see 1915C, it's a home and community-based services waiver. And what's the goal? To keep people at home, give people extra services that other people on Medi-Cal who are not on the waiver would not get, so that they can remain at home and not go into an institution. And so we scroll down some more. And so this is effective January 5th of 2024. The purpose of the waiver, the amendments to the waiver in this waiver are discussed here. Component of this waiver. So this whole document, this whole 401 pages is divided. And if we scroll down, we'll see that Appendix A is how the waiver is administered and operated. Appendix B is eligibility for the waiver. Appendix C is participant services. So if you want to know what services are available through the DD waiver, you're going to go to Appendix C and you're going to see the service. It's going to be defined and it's going to also include what kinds of providers you can have for that service. Appendix D is about participant-centered service planning and delivery. Appendix F, for example, are participant rights, safeguards, Appendix G. So all of these home and community-based services waivers look the same. They have different information, right? Because each waiver is different. But if you want to go to the alternatives waiver and look at the services that are available in the alternatives waiver, you go to Appendix C. If you want to go to the assisted living waiver, you go and you want to see what services are available, you go to Appendix C. Same thing with Appendix B. Appendix B for all of these waivers is the eligibility criteria for that particular waiver. And then if we scroll down some more, we have that this is the name of the waiver, Home and Community-Based Services Waiver for Californians with Developmental Disabilities. It's been approved for 5 years. And we scroll down some more. And this is where the levels of care. So what level of care do you need to meet in order to qualify for this waiver? Remember, if you were not living at home, you would meet the criteria to enter a facility at the level of care as described in the waiver. So it's not hospital level of care, and if not nursing facility level of care, because it's not checked off. So if we scroll a little further down, we see intermediate care facility for individuals with intellectual disabilities as defined in the Code of Federal Regulations. So if you go to 42 CFR, this section, it will outline the criteria, but it's also in Appendix B of the waiver. So what are the 3 levels of care? ICF-DD, ICF habilitative or H, and ICF-DD nursing. Those are the levels of care. So if you meet any of the levels of care of these 3, any of these 3, then you've met that criteria. Doesn't mean you have to go to the institution, because remember, the waiver is all about keeping you at home, giving you those extra services to keep you at home. So anyway, this is what the waiver is. We've provided you the link to the Department of Healthcare Services website, and also you can look at the waiver by going to the DDS website also. Let's talk about the self-determination waiver. It's another waiver through the regional center. You have to be a regional center client. It's just a different model. The model before self-determination was that you would have an IPP meeting with your service coordinator, and then the service coordinator was responsible for putting together the services and supports. You had nothing to do with budgets or plans or spending plans or any of that. So the self-determination waiver offers consumers the freedom to self-direct services that they qualify to receive. Participants are have employer authority. They put together a spending plan. They get a budget from the regional center, and they spend the money in the budget. It sounds easy. It's a relatively new program, so there are kinks. But if you want more information on self-determination, there are links to DDS, the DDS website. You can also, if you're a consumer of the regional center, you can talk to your service coordinator about the self-determination program. There is an organization called Disability Voices United. They have a lot of good material on self-determination, and I think they also have calls where people get together to talk about issues they're facing in self-determination and so forth and so on. So there's a lot out there on self-determination right now. So this is another home and community-based services waiver. The alternatives waiver, there's a current wait list because there are only a certain number of slots per year, but there's priority enrollment for people who've been living in a facility for more than 60 days, or someone who's transitioning from a similar waiver, maybe the DD waiver, because their needs, they no longer qualify for the DD waiver, but they need nursing, they may need those services, and maybe the HCBA waiver can provide those services. And for people who, kids under the age of 21. So there are priority people, but otherwise you're on a wait list. Someone asked me, well, how long are you on the wait list? I couldn't tell you. I think you would need to call the waiver agency or who you applied through, they have a better sense of the current wait list for this waiver. Services include a lot of things: private duty nursing, emergency response system, medical equipment, operating expense. I know they have modifications, a certain amount of money for modifications for the home. And where do you find out about the services available under the alternatives waiver? You go to the waiver and you look at Appendix C, and you'll find all of the services that are available. And here is the DHCS. If you go to this one, it'll take you to the home and community-based alternatives waiver. How do you apply for the waiver? So what you do is, unless you're in Alpine, Imperial, Inyo, Marin, Mendocino, Mono, and Napa counties, you are going to apply through what is called a waiver agency. So you would call that waiver agency and apply for the waiver. If you're in any of these counties here, you're going to contact the Department of Healthcare Services In-Home Operations Division and apply. And this link will take you to all of that information. That's how you apply for the waiver. Very different than the DD waiver or the self-determination waiver, because for those waivers, you have to apply through the regional center, hence you have to be a regional center consumer. The assisted living waiver provides assisted living care coordination to people who are either residing in a residential care facility for the elderly or in subsidized housing. You have to have full scope Medi-Cal, be over the age of 21, no share of cost with your Medi-Cal, and meet the nursing facility level of care. Because you know what, this waiver is going to say, a criterion for applying for qualifying for this waiver is you have to meet certain levels of care, and the waiver will actually tell you what levels of care they allow. You have to be willing to live in an assisted living setting as an alternative to a nursing facility, and able to reside safely in your assisted living arrangement, right? And the assisted living waiver is only available in the counties that you see here. No statewide-ness, right? If you're not in, if your county is not listed here, then the assisted living waiver is not available in your county. Services include personal care services with maybe ADLs or IADLs, chore services, companion services, medication oversight. They're going to have direct care staff 24 hours a day to meet scheduled or unpredictable needs that may occur during the day. They create an individual service plan. More, if you want to see the waiver, you can go to this link here. And if you want to see all the services that are available through this waiver, you go to Appendix C of that waiver. How do you apply for the assisted living waiver if you're in one of those counties that has this available? You apply through the care coordination agency, and you're going to find that information in these links. So you would call that agency and apply. I had a client whose son had reached out to us, and he was concerned with his mom. She was starting to show signs of dementia. He was concerned about her safety and care. And so I contacted the coordination agency here in San Diego. They were super. We found a way to qualify her for the assisted living waiver. I don't know about the other coordinated care agencies, but this agency in San Diego at the time was really good, really helpful. The multi-purpose senior services program, another HCBS waiver. It's for people 65 or older and disabled. Of course, you're getting these services so that you can remain at home and not going to a nursing home. And you would require, if you were not living in in your home, you would meet the requirements for nursing facility level of care. And then you have to reside in one of those 41 counties, and you can go to the link and look at the counties that have this program. There might be a waiting list for some of these waivers, like the assisted living waiver, who knows? But you would know that when you apply. Services includes care management, adult daycare, respite, transportation, meal services, supplemental in-home chore services, etc. How do you apply for the MSSP program? You go to the Department of Aging and you find your county, and then you'll find the entity that you have to contact to apply for the MSSP program. And finally, the Medi-Cal waiver program, formerly known as the AIDS waiver. It provides case management and direct services to people who meet the criteria for the AIDS waiver, right? So you have to have a written diagnosis of HIV/AIDS, and that you can still take care of yourself at home. In other words, you could still remain at home safely. If you were not living at home, you would meet the criteria to enter a nursing facility at the level of care as described in this Medi-Cal waiver program. To find providers, you go to this link. To apply for the waiver, you would go through the Office of AIDS for the state of California. So we've come to the end of the presentation, and I'm happy to take questions.